three students who graduated fairly recently from our School of Nursing. And so what we're going to do is we have a series of questions that we've planned ahead to ask them. But if anyone in the audience has additional questions, you can always ask those. You can put them in the chat box as well. So first, our nurses, let's introduce yourself, your name, what year you graduated, where you're working, and what unit that you're working specifically in any, or who wants to go first? Chave. I'll make Chave go first.
I'll go first. Okay. I'm Chave. I graduated in May of this year, 2021. I work at a lot of places, but my full-time is in the NICU at Children's Hospital, Kings and Daughters. I also work part-time PRN at Patient First. That's an urgent care and primary care facility. And I also still work with Walgreens. I run their vaccine clinic for like COVID vaccines, flu vaccines, Hep B, all your typical vaccines. I also run that. So I do lots of different things, but full-time is in the NICU.
Awesome. Thank you. Okay. And Eva, you want to go next?
Sure. My name is Eva. I'm working at Centrally in the emergency department. I graduated in May of 2020, so last year.
Thank you. Thank you. And Mercedes.
Hey guys, I'm Mercedes. I work at Reston Hospital up in Nova. I'm a progressive care nurse, which is basically step down. We're right next to the ICU, so we get a lot of ICU boarders and stuff like that.
Awesome. Okay, thank you. Okay, so next question. Are you guys working in the department that you thought you would be working in 5 years ago? Or when you started thinking about becoming a nurse?
I'll go first. So yes, but I didn't think that I would end up there so fast. So yes, I always liked pediatrics and all pediatrics. I even like more than just NICU now. So I'm planning to go primary care and go back to school to be a pediatric nurse practitioner. So I like all pediatrics. But I didn't think I was gonna get into the NICU right after school. It's kind of hard to get into the NICU. It kind of depends on your experience and role transition. I had a fairly good experience in role transition. I wished I was at the hospital that I'm working at now. Some of the other students were able to go there. So I kind of had a different transition. I was at a different NICU, a step down. So now this is a bump up for me. I'm at a level 4 now, but yes, this is what I want to do. This is what I plan to do. Pediatrics is my thing, my happy place.
Great. Eva or Mercedes?
For me, I've been angling for the emergency department for pretty much as long as I can remember. So I'm excited that I ended up there and I really like it.
I mean, personally, for me, considering the fact that I was an education major before I even entered into college, before I knew I was going to be a nursing major, I really just wanted to be like somewhere cardiac. Right now, I'm using my unit as I wanted to get my bedside skills and everything. I want to be comfortable and confident as a nurse. So I went to this unit, but I either want to go to ICU or ED. I like both of our units that we have at our hospital, so I really don't know, but we'll see where life takes us. I want to go back to school eventually to get my master's, so we'll see.
Okay, so can you describe a typical day at work?
Busy.
Yes.
Elaborate.
200%.
I'll start. I just got off a 3-day stretch. Considering it varies from day to day. Acuity has been high. It's been a very heavy floor. So like what I mean by heavy is like we have a lot of patients who are like total care dependent or require a lot. We just got more COVID patients on the floor. So I've been working with that every day. And so we've also been short staffed, which is reality everywhere in the world. So our normal patient load is like 4 patients per nurse, but we've been taking like 5 and 6. Which can get a little stressful, especially being a new grad anywhere. And so some days I get to leave at 7:30, other days I've left at 8:30, just trying to catch up on documenting. But it really depends. Life is what you make it. It's all been good. I actually got to do a new skill. I got to do manual peritoneal dialysis with somebody, which is basically we get to build them up. It goes into their abdominal cavity. We get to drain them by ourselves. They don't have the machine, so that's pretty cool. Learn new things every day.
I can piggyback off of you. So definitely a learning experience every day. Every day I learn something new, whether it be a procedure, whether it be a condition, every day is something new. So a typical day in the NICU is busy, as she said. We start 30 minutes early at my hospital. We start at 6:30. That's because we share neonatologists with Sentara Norfolk General next door. So a lot of ours cross. So in order to be a part of our team and their team, we round earlier, and then they go to the hospital next door to round after us and see what's going over there to bring back what they need to us. So we start at 6:30, do report, handoff. Right after that, we do our go in the room, we wipe down everything because COVID and because it's an ICU and babies are really critical. So we wipe everything you can think to wipe down, out of the door handles, the phones, the mouse, the computers, the machines, the baby ISO, everything is wiped down. So you spend a good 30 minutes wiping everything down. Because we're in ICU, we usually have about 3 babies, 2 to 3 babies usually. And that's a lot. I know it seems less than some other units, but they're a lot of work. And they're really critical and they change at the drop of a dime. So then you kind of see what babies you have. They try to pair you up with a really critical baby and a not so critical baby, or if you have 3, you may have 2 stable-ish babies and 1 not so, a feed and grow kind of baby. They try not to give you 2 critical babies, but it happens, you can't control what walks through the door. So you figure out your schedule, make a schedule. I make a plan every day I come to work. It never goes as planned. Don't expect it to, but have a plan. I have an idea, a process of how I'm going to start my day at least, and then we go from there. So I usually see how many babies I have and then see when they last were fed. We go off of feeding times there. So then we base our assessments off the feeding times and then whatever else they may need. Every day is a different thing. Tuesdays is tube Tuesdays. You have to change the tubes. We change lines every day, day and night shift. So you have to figure that in some kind of way. And it just changes. But I get off around 7:15-ish, mostly every day. I haven't had to stay much later, but that also depends if you have an admission or discharge. I've been fortunate to only had 1 admission and 1 discharge, and those were both early in the day. But that's not going to be the case forever. So you may be there late some days, but roughly you're getting off roughly on time most of the time. And people come in, we're short staff also. So kind of depends on what shift you're on. I'm a rotator. I think Mercedes is also a rotator. So we work day and night shift. So just kind of adjust your body to the needs.
Thank you, Chavez. Yeah, Eva, go ahead.
There's no such thing as a typical day in the emergency department.
Yeah, explain that.
Yeah, so you pretty much come in and you get report, and then after that you just try to survive the madness for 12 hours and keep everyone alive and all that. Typically we're supposed to have a 4-to-1 nursing ratio. That goes up higher. The highest I've had my name on is 10 patients at one time, because we were very short staffed and I was the only one on my team left. But so things happen like that. You, as Chavez said, you don't know what comes through the door. And I don't know, like some of the other units, they can say, okay, we've reached our max. We can't bring any more people back now. Our nursing, this is our ratios now, but unfortunately the ED is one of the units that says can't say it, decide how much we want to sometimes to say divert. But it's a good place down there if you like constant change, but it's amazing. I love it down there at the same time.
Good, thank you. Okay, next question. Tell us about your most memorable experience either in nursing school, or as a nurse within HIPAA regulations.
I'll start. So this is actually a conjunction between both school and now for me. When I was in nursing school, I was at Mary Immaculate Hospital doing my NICU role transition, and I had a baby who we had no idea what was going on. She kept throwing up her feeds. Her stomach was huge. I mean, every day it was just something gastro wrong with her. We had no idea. We did all these tests and still had no idea. We ended up sending the baby to my now current job, Children's Hospital Kings and Dar's, right at the end of my rotation. Then when I started working, guess what? I had the pleasure of working with her at my new job. So I actually discharged her recently, about a couple weeks ago, 2 or 3 weeks ago. So that I saw like kind of her whole process. She got there before I was enrolled transition. So she was been in the hospital for a while. Her parents are awesome. They're very supportive. They help in all cares. They rotate, one's day, one does nights, and they flip flop. They probably never see each other, but they see the baby all the time, and they participate in all cares, all procedures. They want to do everything. So they really made a good impact on me, and it just made me, it reinforced the reason why I'm doing what I'm doing. It made me feel good, and especially that continuity care to see like the different stages of her. She actually ended up having her sprung. So that was the final diagnosis. She had a couple surgeries, and now she's home. So proud of her. She's a big girl now. She's like 7 months, 8 months. So she's a big girl now. But that was like probably the most rewarding and exciting thing for like my career so far. It's not been long, but so far, to see that continuity care and work with that same baby in both aspects of where I was.
Thank you. Mercedes, memorable experience?
I guess for me it was during one of my like trying to think about when it was, when I was like first started on my own. I just got up orientation like maybe 4 weeks, 5 weeks ago. But I had this patient for like, I had 2 actually for the entire week. I worked like 5 shifts that week, and I had them the entire week, which is actually pretty good because I got to see from the beginning. Had this one patient, she was super sweet, but she was also had a stroke, and she couldn't speak, so she was nonverbal. Barely anybody could understand her, but like we would figure out communication process and everything. I got her when she was like unstable, like she had an NG tube, she couldn't eat anything and stuff like that. But then I got to see her through the peg tube. I got to see her start walking again and stuff like that. And then when my last day with her, she looked at me. I said, "I'm not going to be with you tomorrow because I have a few days off and you're supposed to leave tomorrow. But I hope you get better. Where are you going?" And she just looked at me and she said, "Why are you leaving?" Like she looked at me and said, "Why?" And I said, "Why am I leaving?" She was like, "Yes." So that was also kind of like sweet because like I got to get to know her and everything. And her family was super sweet. I love working with some of the families. They've been great. And then I had this one patient. He was my buddy. Like he got to go home before I got to have him again. But he would always call me I would always call him my buddy. And he was my buddy. It was just fun. His family was super sweet too. So it's really like getting to see them from beginning to end, like Chavez did too. Like when you get to have them for an extended period of time, it's really nice to see that transition, see them get better.
Well, thank you for sharing, Mercedes. All right, Eva.
On the flip side, if there's beds in the hospital, I normally don't see people for too long once they get admitted. Fingers crossed. Now, we board people in the ED a lot, and we've had upwards of 30 and 40 admitted patients in the emergency department all night, waiting for beds who are admitted. And so then you turn into med surg nurses or IMCU nurses, all that. But so I lack that continuity sometimes with patients. I've had patients who get admitted and I don't even realize that they got admitted, and it's like, "Oh, sure, you've got a bed, you can go. I haven't seen you in an hour, but sure. Sure, take them on up." But let's see, memorable experiences. So one thing that we do is Centera Lee is a stroke center. And so we can take stroke patients. And so one of the meds that you have when you do stroke is called TPA, which is that clot busting medication that busts through clots and is supposed to help when you have like a stroke that basically occludes a blood vessel. And so one big thing with that is you want to make sure that the patient doesn't start getting worse, because that could mean that they suddenly have like a brain bleed now. So it's a kind of nerve-wracking med to give. And so I've given that 3 times. The first 2 times were okay on other patients, but we have a stroke coordinator, and she would send you emails like, "This is what you did good, and this is what you need to fix with your documentation just slightly." So when I got that 3rd patient, I was like, 3rd time's the charm, right? We're going to do like great documentation. We're going to make the stroke coordinator happy and all of this. And then I get that 3rd patient. We're almost done with the TPA, and the patient goes unresponsive. And I'm like, "Oh no, this is not good." And I'm like, "Hey, doc, get in here." And that completely just freaked me out, because I was like, your blood pressure just tanked. We're now in the 80s over 60s, which isn't good, by the way. So their blood pressure dropped. They stopped responding to me. They're super sweaty. And I'm like, "Oh no, what just happened here?" So we stopped the TPA. We get them back for a head CT. and everything came back normal, which was great. So we finished up the last bit of TPA. But yeah, that was probably one of the scariest patient stories I've had.
Definitely. Thank you for sharing that. Okay, so how did your clinical experiences in nursing school help you find your first position after graduating?
So like I said before, I was fortunate to be able to have a role transition in a NICU. It was at a different hospital, but that helped show that I had some kind of experience with neonates and pediatrics as a whole to end up going to that hospital. There's actually a recruiter that came, like, I guess she's an adjunct faculty with ODU also, but she works at CHKD also as a recruiter. And she had this big event with us on Zoom. So whenever you get in nursing school, you will. And you will meet this lady in your last semester and go to that Zoom. It was so informative. It teaches you about the hospital, it teaches you about all the units that they have, what you have to do, the requirements, all those good things. It was great preparation, and it literally set me up for my interview. It's like almost you skipped a step. So you applied, and then they like pushed your application ahead just because of you were affiliated with ODU and you participated in this Zoom. So that I was fortunate to be able to have that experience, as well as that connect with the recruiter that set me up for this full-time job that I have.
I think mine personally, since I went out of the area, I kind of just looked up jobs, but I did my clinical and my role transition in the heart hospital at Sentara Norfolk General. I was on the advanced heart failure unit, which is basically step down to ICU. Really good experience for anybody who's interested in cardiac nursing or anything like that. So since my unit is like a telemetry, so I monitor heart rates, blood pressures, and everything like that, it's more high acuity. We do like cardism drips, like if people convert into different rhythms and stuff like that. We do heparin, we do heart caths. So that really helped me when I did my interview. They asked me a lot of scenario questions about cardiac stuff. So for me personally, it really helped just being able to understand more of the cardiac wise. Didn't really help me into my hospital, but it helped me get the job.
You would do yeah.
Yeah, I know you all have heard us say role transition several times. And for those who don't know, that's basically our final preceptorship class, where we go through, I think, 16 weeks or 196 hours of one-to-one preceptoring with the floor nurse of your assigned unit. And so you pick like 3 top units that you want, and then you get assigned one of them by that clinical coordinator in your final semester. This is your last semester before you graduate. So I was lucky enough to do mine at Chesapeake Regional's emergency department. And so that was helpful to get that experience there. And that kind of showed me that, yeah, the ED is where I want to go for sure.
Awesome. Thank you. Okay. What is something about your job that is different than what you expected?
I'll share something. This is a positive and a negative thing. I've made it a positive thing. But nurses eat your young. That's a thing. It's a big thing. I was told that prior, and I kind of maybe thought that, nah, it wouldn't happen to me. You know, everybody's friendly, everybody's cool, but it's actually a good thing. So while sometimes I ask for help and I don't get the help or the response that I necessarily want, it actually makes me go figure it out. So their answer oftentimes is go look for it or find it here, you know, that kind of thing. But now I don't have to ask them anymore. I know where to find it, and I know where to find other stuff. Sometimes I find things like, oh, I was looking for this too, and I need to know this also. So, you know, I've turned it into a positive thing, but it does happen. And sometimes nurses that have been there for a while, it's kind of like tough love. They want you to learn. They'll show you different things, but sometimes you just kind of got to learn a lot on your own and figure out stuff. So that's just my 2 cents on that. But I don't know how everybody else experiences is, but that it's actually helped me in a way. So I'm thankful for that.
So would you say that when your professors told you to figure out how to find things when you were in college, that helped prepare you for your future career?
Absolutely. Would not say we were spoon-fed at all. I think they're very helpful, but it definitely prepared not being spoon-fed and, you know, having to look for things and actively go get those things and figure out kind of yourself. So definitely prepared. It may seem like tough love in school, but I promise it's for a reason and it's worth it.
I think personally for me was that there's like two things. Same kind of like thing as Chavez, is that it kind of goes personally like learning the differences, like not learning the difference, but like getting used to like days versus nights. Nights are very different. You're more independent. You don't have many people there. We at nights, instead of doctors, there's a nurse practitioner on call for the whole entire hospital. But during the days, you have so much more going on. You have all the scans, all the tests that are routine. You have all the doctors there. So when you're rounding with the doctors, like you have to know who's which doctor. Like we have like 4 different doctors on our floor typically at times. My 4 or 5 patients will have one of each of those doctors typically. Like figuring out who to contact is during the day is very different than at night. And so getting used to that, like with the rotating shifts, has been insane. But it gets easier to go, and like at night you're more independent. So like if you have an emergency going on or like something, you really have to like figure out what to do before it, like while you're calling like the emergency, like the rapid response, which is our like emergency, like if we need somebody in the room, we can hit that button. And then also kind of on a funny and unexpected note, they're remodeling our floor. And so we're now like on 2 different floors, and we're with our trauma nursing on the 3rd floor. So it's like getting used to like when we first did that, trying to figure out where stuff is. I'm already lost as it is. I have to do this for left and right. And so trying to figure out where everything is on a new floor has been insane. And working with another type of nursing unit is kind of weird, but it's been kind of cool because you get to meet new people. But yeah, and also the construction, you know, none of our patients can sleep at all. So during the day when they want to take a nap, it's kind of like, oh, you get cranky patients, but it's fine.
I'm convinced this is the year of nursing remodeling. Like all of my friends, their units have remodeled. The NICU just got remodeled before I went there. Like I'm convinced this is like a remodeling phase for a lot of hospitals. So I think you're not alone. You're not alone.
But the perk is we got a massage chair in our break room. So they ordered us a massage chair. So that's our one perk.
Lan, where's our massage chair in our break room? I'm just kidding. Wouldn't that be nice? All right, Eva, do you have anything to share about something different than what you anticipated for your job?
Sorry, I couldn't unmute myself. I was gonna say, where's our break room first and foremost?
For real?
Let's move on to the massage chair, right? So, all right, sorry. Re-ask the question.
Just sneak in the corner of our office. I'm sure there's room. I was going to say, yeah, Centrally is getting remodels as well, which is really fun because we have to stay operational in the middle of it. And so it's like, oh, look, we invented a new hallway bed. Okay. But let's see, I think the biggest thing that I didn't expect going into the emergency department was how much I like change. Normally, I'm not a fan of change, but the big thing about the emergency department is, yes, you're always changing, but it's also expected changes. What I mean by that is you've got your set things, like you've got a patient who comes in with chest pain, and right off the bat, you know there's a certain amount of stuff you're going to do with them right from the start. And so you've got all these patients who you know kind of by what they come in for. And so yes, you're getting constant changing patient types. Sorry, that's my dog. You're getting all these patients that coming in, but within that, you've got set guidelines preset on what you have to do for each of those patients. And so you're constantly getting new types of patients. One patient might be a stubbed toe or dental pain, and the next patient's going to be, oh, they're coming in cardiac arrest. Everyone come on in here. And then you flip back to having, here's just a regular chest pain or over here type of thing. And so you're managing all these different levels of patients. So it definitely keeps it fresh and exciting. You get patients and they're being discharged an hour, 2 hours later, and you're pulling in the next one. And you're just constantly changing like that. So it keeps you on your toes. The big thing is prioritization. And those priorities are ever going to be changing. And people are going to be demanding your attention like hotcakes. So, yeah.
Awesome, thank you. Okay, Chavez, do you need to jump off? Oh, you're good. Okay, it's her birthday, everyone. So we'll have to say happy birthday before you leave. Okay, so did you have any mentors to assist you in nursing school or in the transition to getting your jobs?
I'll go. She's actually a grad from ODU. I'll say her name. Hopefully she won't be mad at me. Her name's Jasmine. I'll just say Jasmine. She actually works in the NICU at CHKD. So for nursing school, she graduated, I think, 2 years prior to me. I think it was 2. So I got a lot of my books from her, believe it or not. She passed down a lot of books to me, like little to no charge, like $10. Other people were paying like hundreds of dollars for. So I was thankful for that. She taught me a little bit about like what to expect in certain classes, what about my portfolio way ahead of time. You know, you'll learn about that when you get in nursing school. Just different things along the process that help me better prepare and have a look ahead about what to expect. And actually, like I said, she works at the NICU at my hospital, so I used her as a reference also. And she actually had the opportunity to precept me a little bit while I started, while I'm still in orientation, but while I started on my unit. So that was helpful. And she checks on me every time I work night shift because I really struggle on night shifts. I thought I could do this every day. Night shift is hard for me. So to make it through, she really checks on me every time. Like she comes, we want to eat lunch together. Do you need anything? Can I help you do anything? She checks on me every time I work night shift with her. And it's really been helpful to me. She teaches me different things. If she has something cool, one of her babies has something cool I've never seen, she's like, hey, come do this with me. Come see this with me. You know, we'll get somebody to watch your kids for a second. Just, you know, come see this. If it's something cool and a learning experience, she'll come show me. So I'm very appreciative for her. She's made the transition a lot smoother than what I thought. So find that person, meet that person, network, lots of events. You never know who you're going to meet, but it's really helpful for me. She's been a really good asset.
I know personally it'd be like the people like before me. So like I did SNA, greatly recommend it. I was in SNA all 4 years. So when I was a freshman, I knew Naylon, she was president of SNA at one point. And so I still talk to her to this day. Yes, sorry, Brittany. I still talk to her to this day. She doesn't really do nursing much anymore, but she did psych nursing for a while. But she was super helpful when I was in nursing school. And then when I got in, Amanda and Megan, who was going to be here today, but then Amanda's working now too. Megan does travel nursing now, but like I would talk to them every chance that I got. And then now it's like me and this other girl, Chavez, and I graduated with her named Lexi. I talk to her every day. She'll tell me she works at the ED at Sentara Obispy. And so I'll text her and then she'll tell me different stories that she's had throughout the day. And then I'll tell her different stories of things that I've dealt with through the day. We'll do like updates, check in on people because like first year is hard. Like fatigue and stress, and there's been many tears, many days, but it's all been worth it. But it's just like it's so different. Like when I first started, I was like, this is so weird being on my own. Like having access to medications and different rooms and having access to like everything basically is so weird because in clinicals, you have to go with your nurse like, hey, you need to ask somebody for a badge or something every single time. And so it's just kind of getting used to actually, we make this joke all the time. It's like, it's no longer, I'll go get your nurse. It's like, okay, I am the nurse. So that's also it's really just been a lot of different people that have helped me. Like what now in my job, like my preceptors that I have, they check on me every single time that I work because I work days and nights with them. And then in nursing school, like I still ask people, yes, Leah, nursing. But yeah, it's just different people. Like you'll find a person that you talk to every single day, or like while you're in school, you'll find somebody. Like a lot of the teachers were super great too. Like there's this one, Miss Marshall, love her still to this day. She's hilarious. She would, every single time that we'd go into the classroom, she would ask us, are you good? She would make a joke or something, and she would just encourage us along the entire way. Like you'll find different teachers too that are great. But yeah.
Eva, do you have anything?
I'm trying to think. I think they pretty much covered a lot of the things I was going to say, but
okay.
also network with your peers as well. They're going to be your biggest cheers as well. Especially going in from the nursing program, starting from the beginning. The people that I started with like with the learning communities I'm friends with to this day. We went through nursing school, we went through all the prereqs together. The networking there, when if you all end up in nursing school or go your separate paths, you can still forge those friendships. And it's really a great thing to get started from the beginning. I still talk to my friends to this day. I met one for lunch the other week that we met like the first day of class. Oh, speaking of which, that's the one, Andy.
Do you have the, I don't have the video in.
She messengered it to me because it wouldn't come on the Google, so I'll send that so y'all can send it out. But we have one more ODU grad nurse who, yes, Eva and Andy were in the learning community together back in the day. And obviously you're still buddies. So many of the people that we invited to come here today are still friends with people that they met in the learning community. So we hope for that for you all too.
I saw in the email that you invited Chelsea and Lizzie from the event. That's where I did my clinical at, was with them. And so I remember them. I was at the advanced heart failure unit with them.
See, y'all have to be friends. Worst fun. I'm just kidding. All right. Have you had an experience that made you second guess your choice to become a nurse?
I wouldn't say anything's really made me second guess nursing. I think it's just also, I think I've really just second guessed myself in the job, because like there's different things. Like sometimes I'm like, I'm sorry. I always start off with, I'm sorry if this is a stupid question. Because I always feel as if it's like the basic of the basic question, but like I always want to double check and make sure that I'm thinking correctly or something. Or like when I'm documenting, because we have to document so much on our unit. Like Chavez probably does, Eva probably does, like just because like high acuity or something like that. ED's supposed to sometimes.
The operative word is supposed to. They're alive.
But it's like also, I know in my unit, so we get like ICU boarders, ED boarders, which means there are people who have admitted, but who there's no beds open. And so they have to wait typically until a bed's open. And so since we're literally one door over from ICU, like ICU has to go over to us. Like the other day, we see everybody who goes to ICU who's intubated or anybody who's like really critically, like I see people who are on like 6 different kinds of medication drips walk by there going to ICU. And sometimes they come down to us because we can do it, but there's no beds open. And so I think it's really just handling the stress of it all. And then I second guess myself. Not really second guess nursing. I still love it.
I totally agree with that statement. Not necessarily second guess nursing, but second guess yourself. And for me, maybe even the unit. So a lot of people don't start off in ICU fresh out of school. Sometimes they don't even allow it at certain hospitals. And I definitely understand what they were saying in school, that you'll hear this a lot about, it's okay to start on a step down unit. It's okay to start on a unit other than an ICU first. I extremely see why that's important and why one would choose that route as opposed to going straight to ICU. It is a big jump. It is a huge jump. I mean, we barely, some of us did, touch lines in school. You learn basics. I have to change whole line sets on my babies every day. Night shift, day shift, clears, TPN, lip, whatever, you name it, my baby has it. And I have to change it every day. And I had no idea what a microclave was, no idea what all these things were and all these parts and sterile procedures, no idea. But you just learn and you just go. So at first I was like, man, what did I get myself into? This is an ICU. And I know this is not great, but you just learn, and there's people there to help you, especially during day shift. There's more people to help you. And they just take their time and really try to explain each step, and the why is really important. That has helped me, like the why behind stuff. Then I won't forget it. I'll know we use microclaves because it's an infection thing and because it gets the bubbles out of the lines. Okay, I know it's important. Now I won't forget a microclave. I'll know where that goes. That's important. Can't have bubbles in my line, different things. Just understanding the why. So I wouldn't say necessarily question nursing, but questioning the journey or the process. I really enforce now, it's not a bad thing to start on a step down unit first. I think it's actually a better step. It'll make you a better, if you want to be ICU or ED nurse, possibly with that med surge or step down unit background, so that you can learn those basics and then take them to the higher acuity, the higher ICU and critical patients. So adding on to you.
Yeah, there's also like before, like even there's also the stereotype that if you don't start off in like ED, or if you don't start off in like this ICU, like high, like best of the best setting, like that you're that you're like settling or something. It's never really settling. You go where your heart desires. Like if I want to be in med surg, I'd go to med surg. If I'm in a step down unit, like I love my step down unit. A lot of other people who I know who did ICU, they don't like ICU, they like step down. So it's not like, don't let ever somebody make you feel bad because you go to like a different unit. Like, like Chavez said it too. Like it's, for me personally, I'm using this as a step to where I want to go to make sure I get my skills down. It's not a bad thing.
Anything else?
Not at all. And don't be afraid to like jump around either. One last thing. Don't be afraid to jump around. Like I said, I do lots of different things. I work with peds, I work with adults, I work in vaccine clinics. I mean, you don't know your niche until you're exposed to it. I wasn't exposed to a vaccine clinic, maybe a little bit at the end of nursing school because we were COVID grads. But aside from that, you may not have been exposed to that. You don't even know what that's about. You have some public health, but you didn't see that side of nursing. You haven't seen all the units that there are to be. There's a million different avenues, and I'm not even exaggerating, a million different avenues in nursing. So psych, that's another one. I missed my clinical for psych, so I can't speak a lot about psych because COVID happened. So it was virtual, not really the same. But it's just, don't limit yourself. Do lots of things. You don't like something or you think you might like something better, try it. Go for it. They'll take you. There's help. They need help everywhere. I promise. You will not have a trouble finding something that you like. Just hop around if you need to. Do what you got to do.
And a piece of advice with that as well is if it's not working out, that's okay. But work with your managers, work with your preceptors to find someplace that does work for you. The worst thing you can do as a new nurse is stay in a situation where you aren't learning, where you don't feel supported, where you aren't growing as a nurse. Especially, yeah, that's a big thing. If you talk with your manager, they want you to be where you're happy. You're the best nurse where you are happy. And so, and satisfied with your work and you like it. So if you need to transfer, there's no shame in that as well. We've had plenty of people who come to the ED and every other unit has their own stories, but figures out this is not the place for me to be. So work with your manager, find out where is your low niche in nursing. As she said, there's 1,000,001 different places for you to go. You just have to find it.
Awesome, thank you. All right, so few questions from the chat box. Specifically to Ava, in emergency nursing, what is your balance with the stress level and working in such a fast-paced environment? Do you feel like it affects the quality of what you do?
Oh, that's a loaded question. I've been actually staring at that one at the meeting, trying to figure out what's my answer to that. I feel like it all depends on the night. Obviously, if there's something critical that comes in, everything else down my line will bump my priorities down. One thing that unfortunately is very true is that you will never die from pain, but you will die from what's causing that pain or anyone else's things. And so I get a ton of people who call me saying that they're in pain. And so I'm like, I know you're in pain right now, but it's controllable. We know why it is, and this is what I need to do to fix what's happening underlying. And I'm sorry that I can't give you pain meds right now, but I need to do X, Y, and Z right now to help what's going to hurt you a lot more than the pain that you're feeling right now. But I also have those patients who, like, as I mentioned earlier, swapping from high acuity patients to patients who are, I came in for dental pain. I've had this thing, I've had this pain for 3 years and I've gone to 5 specialists. And you're thinking in your back of your head, so what makes you think we're going to figure that out right now at 3 a.m.? But other than that, yeah, it's balance is a really interesting thing in the ED. I think the big thing is learning to leave work at work, which is really hard sometimes. And also learn outside, find what makes you happy, whether it be reading, video gaming, take up crocheting, I don't know. But figure out what things make you happy. Make sure that you connect with other people, especially if you're like me, who's a constant night shifter. Do interact with like day humans, find people. Yes, day humans is a phrase and it's a thing. and night humans versus day humans is very different. They've talked about it in shifts. We run whole different sides. But yeah, network, find your people. Don't let yourself drown in work. It's really easy, especially when everyone's short staffed. There's a lot of things going on. And in the ED, you see a lot of scary stuff. You see a lot of super sad stuff, things that really scare you as well. But yeah, and find out who on the unit as well you can network with. I've got my preceptor who precepted me. I've got coworkers I forged good relationships with that I know have my back if I need to talk with them or if I have questions. So find those people and they can really help out with the stress and all of that as well.
So we do have a couple of questions in the chat. One specifically for you, Eva, about emergency nursing. I guess Sydney's interested in emergency, wants to know about your stress level.
Leanne, we just did that.
Oh, how was I not? Oh, never mind.
Okay,
That's not what I heard.
It's okay.
I heard you talking about experience to, never mind, move on.
It's okay. It's okay.
What happens when you multitask and you try to listen and answer emails at the same time? Students never do that. Did you answer the internship thing?
We did not do that one. Yes, the internship one.
That one.
Yep, that, and it's kind of, I think it could also be paired with the psych nursing, because I know Chave mentioned it before that she did not get her experience in psych nursing. So we'll kind of tie them both together for internships for nursing students, and if anyone has any information on psych nursing that they'd be willing to share.
I know
I'll
for
start.
internships.
Go ahead. Go.
I know for
Mercedes got it.
internships. I know for internships, I know at my hospital, we have a lot of nurse externs who can basically, they're kind of like CNAs, but can do more nursing work. So they can do straight cathing with the nurse. They can do Foley catheters and stuff like that and do different things just to like expand their skills. You basically work with the nurse. You work on the floor and then you'll work with the nurse to like do different skills. Like they'll have like a different set handout. I love our nurse externs. They've been great. They help out a lot with if we can't do something that's within their role that they can do it. And then psych, I did my psych rotation at the Norfolk Journal. Very interesting. Depends on where you go for your psych clinical and where you get your psych nursing, because different hospitals are different. I had a friend, Lindsay, Chave knows her too, Lindsay, the one with the short hair who loves psych nursing. She's actually now in Scotland getting her master's or doctorate in psych. She didn't take her NCLEX, but she basically memorized the DSM-5. But where she went, I think it was like Virginia Beach Psych or something like that. She loved it. Norfolk Journal is very different because it's just a unit on the floor. It just depends on where you go. I actually kind of liked mine. My psych experience, we saw a lot of different things. You see psych everywhere you go though. So like on my unit, I see a lot of, like the past few weeks though, I see a lot of CWAS. So it's like a lot of people going through alcohol withdrawals, and like some of them are getting really bad. Like some people are not knowing what they're doing, kind of unconscious in a way, but like they're unconsciously being combative, if that makes sense. So it's like you have to be really on top of it. I see people all the time going through drug withdrawals. I see people all the time. I've had somebody who has PTSD. I've had people with depression, anxiety, bipolar I've had. So you get psych everywhere you go. But for specifically only psych nursing, depends. We have a hospital here called Dominion Psych Hospital. And I have a few friends who went there that I met in my program, and they love it. They have a pediatric, they have adolescent, adults, and then geriatrics. So it's actually really cool how different hospitals are set up for psych. So
I've got a lot to say to that too. Okay, so residency, nurse internships. There's a few different ways you can go about that. Some hospitals, like Mercedes said, have in Norfolk, they have something that's called registered nurse assistant. It's a RNA. So a lot of times it's prior to you taking your NCLEX or while you're in nursing school, where you have some of those basic nursing skills, but you're not quite an RN yet. You know, you're waiting on that day to come. They have opportunities for you to essentially work as a nurse assistant and do a lot of the things that nurses do. You may have to work under a nurse, which is fine. Have people sign off. You'd probably love that. I wish I could still do that. Sometimes, it's kind of great to have somebody double check behind you, and you feel more, it builds up your confidence also. So I think if you're interested in that, you can look into some positions that do that. Also, I worked throughout nursing school. I don't know if y'all have time to do that, but I worked as a medical assistant and I learned lots of things. I participated in draining wounds, wound care, emergency stuff. I learned how to start IV, all different types of stuff as an MA. So I wasn't quite a nurse. I also worked in the office with Leanne and Brittany too. So you got some other sides of nursing and dealing with students and learning about the not so clinical side about things. So it's just a lot of different avenues you can do. I was also a pharm tech that helped me with past pharmacology. You'll know what I mean when you get there. It's a rough class, but just different experience that you can have that can build up your nursing resume and prepare you to be a nurse. On the psych thing, I also have a different side thing to that too. So I was right when COVID was declared, I don't want to say hit because it happened before then, but right when it was declared, we went on spring break and we never came back. So after spring break was when I was supposed to switch to psych, because half of us did adult health in the beginning and the other half of us did psych, and then we switched. So I did the adult health part and never got to do the psych. It ended up being virtual. But I think I would have liked psych. I'm actually still interested in psych. I may go on and do something like that later in psych. And really, I bet my other nurse friends could attest to this. Every patient is a psych patient, good, bad, ugly. You may have good things that is not necessarily a psych diagnosis or something that's completely outrageous, but every patient, you should treat them. Say it again. What was that? Oh, okay. I thought somebody was saying something, but yes, like every patient can be a psych patient. Even in pediatrics, you can have pediatric psych or parents. Sometimes they're going through rough times and it's rough for them. It's rough for us. It's rough for the baby, and they have breakdowns and they have moments and they need to talk about stuff too. You deal with psych on many different levels in all aspects of nursing. And if you're interested in pediatrics, you'll be glad to know that CHKD Hospital in Norfolk is actually building a new psychiatric pediatric hospital, and they are looking for mental health techs, which does not necessarily require a certification, just requires some previous experience or something else that you're interested in doing that. You can start there, and then when you become a nurse, I'm pretty sure it's an easy step up process. They'll be glad to have you experience in that hospital, and boom, bump up and go into nursing in that, or become a care partner or things like that you can bounce up or escalate your care and skills to kind of piggybacks with the psych and with the internship process.
For those interested in like the emergency department, you can also volunteer and become an EMT and go through like rescue squads. That's also an opportunity. Yeah, what they say in the chat. Yeah, so you have that opportunity. I highly recommend that if you're interested in that. Yes, they will train you for free. You do have like a 2-year commitment to volunteer with them afterwards. And if you need to leave that earlier, then you will back pay to pay for your training that you did with them. But also with that is, yeah, so those are also good opportunities. You can shadow people, try get networking connections. Just being able to watch people without the pressure of having to do anything is also really nice and a great learning opportunity as well. So yeah, seek out those opportunities. You have a lot to choose from, and then get as much experience as you can before you hit the nursing field. It can help to, give you idea of where you want to go. It can help solidify, oh my word, I do not want to ever do this again. That was me, med surg nursing in every single clinical. I ran to the ED pretty hard with that. And then here I am taking med surg patients all night for boarders. So, I can never escape, but it's good.
For those who don't know, tell them what med surg is.
I describe it as about to go home, basically. So like we have there's different steps in nursing. There's med surg is like bottom tier, like patients who are stable, basically nothing should really happen, there for observation in a way. Progressive care.
It's your encompass all unit. It's everything.
Yeah.
Unit.
Everything.
Kinda. You see a little bit of everything. It's not specialized, but a little bit of everything.
Yeah. Then you have like step down, which is basically, or progressive care for me is what it's called. You have more high acuity, or some of people who are less stable, but they're not going. ICU is where you see all the intubated patients, the people who are probably like on the border of dying. ED basically encompasses everything.
Yes, we see
ED
everything.
sees
It is
everybody.
the first step. The first step.
ED's first step, and then they kind of, there's like places in the hospital that determine like what kind of care they need, and then they get distributed out to the hospital.
Usually that's the ED that decides where you're going.
Yeah, they do triaging. So triaging is a word that they use a lot in nursing. It pretty much means decision making on where you need to go and your status. That's pretty much what it means in
And
so
how
many
fast
words.
we need to see you.
Right. So from ED, then they decide whether, okay, you're really critical, you need a lot of help and a lot of attention and a lot of lines and whatever, I see you. Or, okay, you're, not quite really stable, but you're not sick enough to really need that one-on-one or those vents and everything. I'll go to a step down. Or you're here for some dental work, like she said, or you're here because you need some kind of surgery or something placed. You can probably go to med surg. That's where they decide kind of where you need to go.
But with everything in nursing that is super fluid, if they start at one place doesn't mean that they're going to end up there. I had a patient last night who started med surg, and middle of the night he went to ICU upgrade, and
Changes.
so things like
In
that
seconds.
changes all the time, and it can happen on any floor. So
Yep.
it's not.
A lot yesterday when I worked, we had a lot of crazy, like we got 2 COVID patients, mom and son. Son was doing fine. Whoever got her, I got the mom who was like maxed out on high flow oxygen, wasn't doing so hot. So it's like she was like almost ICU, but then like came to us because she's on needs to be intubated. So anything could happen. We had a COVID patient who was like their oxygen levels was going down to 85, 82 on the max we could do on our floor. So then they had to be shipped right to ICU. It's like lucky because we're right next door. But I will also say about the experience portion, definitely get experience before you go into nursing. Because for me, I worked as a resident assistant on campus. I was the health professions RA at one point. I was in the LLC, the Living Learning Community, my first year. I worked as a CNA at a nurse. And I also was in the hospital and I shadowed. And so be careful with how much you work, but also get some experience in before you go in, because if you find out halfway through nursing school that this is not for you, you're already halfway through nursing school. So
you're going to be mad. You're going to be upset. That's a lot of work.
Yeah, but there's also different things that you can do in nursing. Like you can do an office job, you can work, you could do bedside, you could do office jobs, like you could work out of like a physician's office, you could do anything really. You could do public nursing, you could do school nursing for all you want. Like
you can work in the jail, you can do all types of stuff.
Actually, kind of funny story. I had a friend who I just met through my program, and she was actually an LPN. She worked in the jail for like 3 or 4 years, and then she went back and got her RN, and now she works in the emergency department at our hospital. And so like you can start off at any point. I know people who were a nursing care partner and they went up in their floor, and then we actually have a person who's like a telemetry technician, so they watch heart monitors. You can do that too to get experience. You could do telemetry monitoring to see to kind of get used to certain things to start off, and you could do nurse aid, CNA or something. But we have a person who started off doing that, and now he's going to be a nurse on our floor. He's still waiting for his ATT from June. So board of nursing. Yeah. We had people in our program waiting for their ticket to test to take the NCLEX until like August.
Me, 3.5 months, 4. Yeah, it's okay. It's fine. We're done now. It's cool.
Yeah. So just with the 1 minute that we have, and I feel like you all already kind of hit on it, but the last question is a piece of advice for first year students.
Tears are okay.
What'd you say?
Crying is okay.
Oh.
It really is.
My Tuesday class,
Study
I say
hard.
that to you all the time. Crying is a normal reaction and emotion.
People have seen me in the hallways at work. Like, I think, what was it? So, okay, I worked Halloween.
Oh gosh.
It was terrible. Like, I had 5 patients, all of them needing something. We were short-staffed. It was Halloween. I swear it was a full moon, and I cried in the hallway twice.
It's okay.
It's okay. And then there's been days
It
where
really is.
and then there's been days I haven't got my 30-minute break because stuff just happens. Life happens.
I'd honestly be worried if you were just starting out nursing and in your first 2 months you didn't shed a tear. You're overly confident and you're not doing something right. Like you're going to have those days. It's something you don't know everything. You're gonna get overwhelmed. It happens. You just take every day by day, minute by minute, hour by hour, however you want to look at it, and just go for it. You just gotta go for it. You gotta do it. That's the best thing I can say. And first year students, get that cert. Do those things that will help you get into nursing school and better your career. Do those classes. Make friends, make connections, network. Best thing ever. SNA, she mentioned earlier, Student Nursing Association. Do it. It helped me even prepare for NCLEX. I didn't even know what HERST was. That's a program to help you pass your NCLEX. No idea what it was. But we went to some meeting in SNA and it had a crash course, and that was the best thing ever. I probably learned more than that than I learned in a week in nursing school, probably in a couple hours. So, I mean, you just meet all types of people, learn all types of things, network, meet people, have fun. I have to say that. Everybody else gonna say study. Have fun. Because sometimes you won't have that time in nursing school. You got to be studying and you got to do stuff. Have fun while you can now. Study a lot. Don't get me wrong. I'm not saying don't study. Do your homework first, but then make time to have fun. Make some time for yourself. Even as an adult, when you're in nursing and after, you got to have that balance. As we were talking about that work-life balance, you got to have that because it can get rough sometimes. You just got to find your happy medium.
Make your friends now, because when you get into your nursing school, you have those people that you spent the first 2 years doing prereqs with, you'll be like, hey, you want to be my study buddy? We remember this from this thing. You start those seeds now and they'll be your lifelong friends. It's great. I made friends in my learning community that I did first semester on, and we signed up for classes every semester together, and we were study buddies all through nursing school. We panic studied together. They tell you not to do it, but you will live if you do it.
Panic studying happens.
Yes. The night before, crash study. Come on, dude, let's do this. But it works, guys. You guys got this. Good luck.
I have a question for you, because I know a lot of our freshmen. Take yourself back a couple of years and remember chemistry. And I think that's the one that's getting them the most. Tell them how to get through it.
So chemistry. Who do they have for chemistry right now?
Dr. McCoy.
Oh, I
For lab? That's for class or for lab?
Both.
Oh
my, that's different. So actually, okay. Wow.
I know that I had a very different teacher, and my teacher was very different, very easy. Who did we take it together? No, we didn't. But do we have the same teacher?
Who was your teacher?
I don't remember her name. She was an Indian lady.
Oh, that lady wasn't Indian. No.
Okay. So I had a very different teacher, but what I will say is make sure you read and practice. Like whatever, like I don't really remember chemistry all too well right now, but just make sure to pass the test, just read through and make sure like don't rush through things. And just if you need to, I know for all of school, I watched crash course videos on YouTube. There's something for everybody out there. Even for nursing, I still use crash course to make sure that I understand something. But
YouTube is your friend. YouTube is your friend for chemistry. My other good advice is write it down. I know everything is technology now, and you bring computer class and you take all your notes. I did that in nursing school too. It's fine. Chemistry, I had to write. I brought a notebook, paper, yes. Loose leaf paper, old school, yes. Pen, pencil, write it down. You have to write it down. Take a second. Yes, I'll give you my email, or I'll send it. Leanne knows my email, but yes, you can have personal, whatever ODU, I will respond, phone number, I don't care. But anywho, chemistry,
be careful
I had
with
to
phone
write
number,
it down.
Shave.
What about my number?
I said, be careful with phone number. Give it out.
It's cool. That's fine. I don't mind helping. Everybody has my number. It's fine. But write it down. Do they still have those review courses? So like the review session. So I remember, let's say our test was on Friday, the day before, or that Wednesday or Thursday, they had these late night review. Do they still do that? Okay. I don't know, but
They have like 5 sessions. I don't know anything.
Maybe.
about it
I don't know.
other
They
than
had
that.
that for me, and it was like, it was usually a student, somebody who sat in the class and took notes with you. There was like a grad student, and then they would run the review session. Anywho, find out about that. See if they have that. If they have that, go. I learned so much. So the initial learning was in the class. You may not have got everything. It went by fast. I did it 3 days a week. It was an hour. An hour is a long time for chemistry, and it's nuts. Numbers and it all runs together. So go to those review sessions. They also have chemistry tutoring on campus. I hope they're back in person doing that. If not, they have virtual.
MSRP. I do
Do
remember
it. Go to it. I don't care if it's the day before the party. I don't care. I went to it every single week. That's what I had to do it. I got an A in chemistry. I said, oh, sometimes no to going to this event on campus or going to do that. That's fine. Still got an A in chemistry because I decided to go to those tutoring. Does not mean that you don't understand. I understood most things in chemistry, but I still went to the tutoring. There's nothing wrong with reinforcing and getting better at it. Go to the tutoring. Doesn't mean that you don't know anything or nobody's gonna look at you sideways. Go to the tutoring, because I promise you, you'll be doing better than those who don't go.
And don't be afraid to go to office hours or ask questions, or like even to email teacher. When I was in school, I emailed my teachers like with any questions that I had. I know for anatomy, I had Dr. Stevens. I went to his office hours so many times because his class is notoriously hard for anatomy and physiology. But I went to his office hours, and I also went to other teachers' office hours, like almost every like chance that I got, just because they would know your face, know your name. They know that you're trying, you're putting forth that effort. Like in nursing school, I would go talk to my teachers. I would email them. I would text them. Like some of them would give us like a number to text if we needed to, especially for like clinicals, if like we were being late or something like that, or had a question or had a concern, we could go to them. Don't be afraid to go to your teachers. Like, yes, like you're one face in like 300 students or so that they have, but go make your face known and go make your name known. Like they will appreciate it so much more if you ask them the question rather than you just trying to guess it.
Networking is important again there. Your friends you may not have heard something in class and your friend may have. Now together you got the whole piece of the puzzle. You might have 50%, they might have 50. Together now you know the whole problem. YouTube is your friend. I'm telling you, I did extra problems on YouTube. Nobody wants to do that. Nobody wants to do that on Friday night after a class. I know, but do it. Those extra questions help. 2 or 3 maybe. It may not even have to be 10. 2 or 3 might only take you 10 minutes. But now you know you got it down. Extra questions. I don't know if they still give a book or if they have like online stuff that you can go to. There's also Khan Academy. They have chemistry stuff on there for you to find extra lessons and reinforce. Maybe they're not teaching it the way that you understand. Maybe you don't know how to divide this way. You know how to do it this way. Or maybe percents are easy for you to handle and as opposed to decimals. I don't know. Figure out your niche and find what makes you learn the best and go with that. There's other platforms. You don't always have to get it the first time that the teacher says it. There's other platforms that can reinforce and teach you. And your friend may know a different way. Like, hey, I didn't do it this way. I did it this way and got the same answer. It may be the same exact way, but taught in a different way, shown in a different way. Boom, you got the answer now. Just network again.
I know for chemistry, Leanne probably remembers Anna and I had almost every single class together. And so for chemistry, I would teach Anna and Anna would teach me, like, go get a whiteboard, go to one of the study rooms in the library. We would go to a whiteboard and we would teach each other, because if you can teach the material, then you can understand it. It may be hard, but if you figure out how to teach it like to somebody, like, and try to go through the whole process, then you could more likely to understand it. That's what I did. I would even talk to nobody in the room like I'm teaching somebody, just so that way I can learn how to explain it. And nursing, it's just like when you're a nurse, you're educating your patient, whether it be on diabetes. You're never going to teach anybody about chemistry like in real life, probably. But like if you think of it as like when you're a nurse, you're educating a patient on something. That's how I would think of it sometimes too. Like you're eventually
going to be teaching method, by the way. It's called
you're going to be teaching somebody your entire life about something. Just letting you know that now. You're not going to be just a nurse. You're going to be an educator as well.
All right, I'm giggling because I know that y'all can keep going back and forth all night long on this stuff. And I really wish that I could like bottle y'all and turn you into a hologram and make you pop up in my hand when I was in a meeting so you could tell people that. But thank you very much for sharing your sage advice. Shave will